Hi, I am Dr. Hanmant Reddy, Consultant Intervention Cardiologist, Care Hospitals, Banjara Hills. Today we will discuss about heart failure. Most when you are coming up in a heart failure, what are the common causes of an heart failure? Nowadays, the common causes of an heart failure are coronary artery diseases, which is causing a blockage in the artery which is supplied to your heart, which is causing a heart function to weak. So it is known as ischemic cardiomyopathy, LV dysfunction due to coronary artery disease. Other causes are the muscle diseases. In some of these cases where the muscle will be weak, it is known as dilated cardiomyopathy. The causes can be various causes. It can be due to muscle itself, it can be due to hypertrophic cardiomyopathy, it can be due to restrictive cardiomyopathy. In some of the cases, it is genetic conditions which is causing a muscle to damage. In some of the conditions where amyloidosis, other infiltrative disorders, where some amount of an extra interstitial substance is adding and causing your heart will be weak. Coming to a third cause, in a valvular problems. In heart, there are valves which is it will allow blood to be going to one side. So in a mitral regurgitation, aortic regurgitation, because of an increased volume of the blood, it is going in heart failure. In some of the congenital cases, in pediatric children, there is a ventricular septal defect, atrial septal defect itself can also lead to a heart failure. In some of the cases, the pericardium, because of constrictive pericarditis, can also lead to a heart failure in at a later stage. When you see what are the symptoms of a patient when he is having a heart failure, most common symptom will be they will be having breathing difficulty on walking, and some of the patients may also feel breathing difficulty while lying down flat. So in night when they sleep, they will not unable to sleep, so they will be sitting. In some of the cases, there will be swelling of the legs, swelling of the abdomen. Some patients may feel giddiness. In some cases, because of a heart failure where your heart function is weak, it is not going to pump properly, there is a decrease of blood supply to the kidneys. It can lead to a decrease your urine output. In some of the cases, it can be very severe, even it can lead to in some of the patients to dialysis. In severe cases, the heart is unable to pump normally. It can cause fluid retention in your lungs and it can lead to a pulmonary edema. So that time the patients may require ventilator support and oxygenation. In some cases, the blood supply is very low. They require some inotropic medications to increase pumping capacity of the heart and the blood pressure to maintain overall perfusion to all organs. Once these symptoms are there, what are the tests you need to know? Most important test once you are diagnosed with a heart failure clinically is you need to undergo an ECG, echo. In some of the cases, we also do a coronary angiogram. If it the coronary arteries are normal, we need to see how the structure of an heart. So we will also do a cardiac MRI and other things depending on this condition. Once you are diagnosed, we always monitor your blood pressure, RFT and LFT and CBP. Depending on drugs, we give some medications which will increase your urine output known as diuretics and beta blockers to keep your heart rate control. Even after diagnosing heart failure, once you're clinically improved, you need to do an adequate exercise, regular physical rehabilitation and lifestyle modification, and good healthy diet is proper. Once you're diagnosed with other risk factors, diabetic hypertension, it's need to be controlled. Regular follow-up with a cardiologist is mandatory. Thank you.